to Pet's Life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
And a very good morning to all, and a very good morning to Des Groom. How you doing, Des?
Hi, John. Good to be here. Yeah, great, thanks.
Grand. Some questions begin to come. We'll get to those in just a second. So we're into kind of the weather seems to be picking up a tad. The temperature's not too bad. And I suppose animals, are they up to mischief this time of the year or anything?
Oh,
generally?
yeah. Oh, yeah. Look, when the weather's a little bit better, cats and dogs want to be outside more. We're just beginning to get a little bit of a stretch in the evening, so I'd say to people, do get the dogs out for slightly longer walks from now on. Along the canal banks there, Rathangan, Milltown, those areas near us, near and dear to me, close to Kildare. It's lovely to get the dog out in the evening. And I must say, Bonnie loves her strolls along the canal bank, and she tries to get in to get at the ducks or the swans, and all it takes is if a male gives a bit of a squawk, gives her a warning, she backs off. Yeah.
I love it. I absolutely love it. But, you know, it's most important as a pet owner to get your dogs out walking, isn't it?
Sure, this is the whole thing. One of those American animal behaviourists on the TV, it could be the famous guy, Caesar, what do you call him? 90% of dog behaviour issues can be solved with improved exercise and more exercise.
Yeah, bring them for a good long walk so they're knackered when they come home. Give them a bowl of water and they'll crash out for the rest of the evening. All they want is attention and exercise, stimulation, tire them out. Yeah. As close to their natural lifestyle as possible, and they're happiest. Does it vary from breed to breed? Yeah, it does. Okay, so sighthounds need to exercise probably little and often. They get tired after short bursts, whereas hunting dogs, like the German Shepherd, like shepherds and so on, they need a longer walk. Right. Collies that are closest genetically to recent working sheepdogs, they are indefatigable, as they say. Impossible to tire them out. Yeah, that's a good word, isn't it? It's a great word, actually. Yeah. Indefatigable. Indefatigable. You can't tire out a collie. Collies just want to go all day. That's the reason why the farmers use them, is it? Yeah. Yeah, springers as well. Of course, they were genetically selected for their ability to work. So they're highly athletic animals. Yeah. And they want lots of exercise, lots of stimulation. So if you're a type of person who lives in a smaller house and you're commuting for work, you're away, you have a dog like that, a collie or a springer, then that's an ideal candidate for a doggy daycare service if you have one near you. A sighthound would probably sleep away okay and chill out for the day and be happy with a burst or a run morning and evening. But a lot of the hunting dogs need more sustained, longer exercise, yeah, for sure. Yeah. Okay, well done. And some good tips there as well. Now, I want to turn our attentions to a topic of conversation. And you sent me some photographs during the week as well. Thank you very much. But today we're talking about more about animal dentistry. So define what animal dentistry is, first of all. Well, animal dentistry is when you have a veterinary intervention in the oral cavity, or in the mouth and teeth of an animal, a companion animal, be it a dog, a cat or a horse, and you're doing so for the purpose of improving the animal's quality of life, and that will also impact on and have a bearing and improve its use and its fun as a companion animal or a pet. So quality of life, veterinary treatments that are going to improve the health of an animal in its oral cavity or teeth. So that's what animal dentistry is, and we're doing more and more of it. And the reason we're talking about it again is because we've put a new dental suite into Kildare Vet Surgery in our hospital, because the abilities of what we can do for dog and cat dentistry in particular is improving all the time. So I thought it'd be fun just to talk about a recent case where we kind of made history, to be honest, John. Okay, well done. Well, then you might as well brag about it. I say brag about it. I say, yeah, kind of lightheartedly say we made history. So we have a lovely boxer dog called Buster, owned by a very good, very attentive lady client, 5 years old. Okay. And Buster was suffering from periodontal disease and hyperplasia of the gums. Now, that's common in boxers, is where they get a swelling of the gums, which affects the firmity of their tooth roots. And in addition to that, he had a lifestyle of catching sticks and biting and chewing, and he sustained a few cracks to the teeth. The pulp cavity was exposed, the nerves were exposed, and as a result of the periodontal disease, there were a few teeth loose. So we had to do some dentistry on Buster, and Buster, coincidentally, was owned by a dentist.
which was great because she was right on the same page as us from the word go. Initially, there were some dental x-rays done on Buster, and we could confirm exactly which teeth needed to be extracted and which ones didn't. So we extracted the ones that had the weaker roots. And the other teeth, again, we were discussing, I suppose, in the conservative, in the old-fashioned way, discussing with the owner that we'd have to extract these, the ones with the pulp cavities exposed. And owner being a dentist, she said, hey, what if we crown them?
Okay. And come here, listen to me. I have to ask you. So the owner of Buster is a dentist.
Yes.
Why didn't you get her own practice to do it?
Her dental practice?
Yeah.
Because animals need a general anaesthetic to have dentistry.
Right, okay.
So it has to be done in a veterinary hospital setting.
Okay, get you. No, that's okay. I just curious what the connection. So they approached you basically.
Yeah, so she's completely unfamiliar with the normal anatomy of a dog.
Yeah,
but she got up to speed very quickly. She was fascinated with the difference in anatomy between a human mouth and a canine mouth, obviously, right? And it was her suggestion, can we crown Buster's teeth to save them? So we were open to the idea. We looked into the veterinary crowning process, and it's way above the level we're at in Kildare, and it costs thousands to do so. But with her help, we were able to do it.
Okay, so it cost thousands, and how did you do the bit of research on it? Because if you hadn't done it before, did you get a bit of advice?
Yeah, I got some advice from a couple of veterinary specialist dentists that are out there. There are vets that do nothing but teeth.
And did they just come in and do it into your place?
No.
No. Sorry, I missed it.
So we found out what we needed to do.
Yeah.
Right? We got the owner up to speed.
Yeah.
She brought her human dental instruments.
Okay,
and her human dental equipment.
Yeah.
Into the surgery.
Right.
My team anaesthetised Buster.
That's where we're getting to.
Yeah, my team anaesthetised Buster. Buster was in the dental suite, anaesthetised, right? Human 3D printing technology was used.
Yeah, as the pictures you sent me.
To print moulds
saw
of
that.
Buster's mouth.
Yeah, saw that.
Focusing in particular on the damaged teeth. The moulds were then used to manufacture crowns for Buster.
Okay.
And on the second visit, the specially made crowns, canine crowns made in a human dental lab. Yeah. Right? Out of the metal alloy materials.
I can see it, yeah.
Right? And now we use metal alloy crowns for Buster. At a more human level, if it was yourself, John, you'd probably have a ceramic crown.
Right.
Because it would look more realistic.
Yeah, but
this would be probably an older style of crowning in terms of what human dentists would do, but perfectly adequate for Buster.
Okay.
Right? So Buster had silver alloy crowns.
Yes. Yeah.
Implanted, but by his dentist owner with the assistance of our veterinary team.
Right.
Yeah.
How long did it take?
Well, okay, so an hour probably for the initial moulding.
Right.
And an hour 2 weeks later for the crowning.
Right, okay, fair enough. So now you can get dogs crowned?
You can indeed.
But could you... Okay, I know you're saying like it was a kind of a one-off kind of thing that you came together and you collaborated together and you came up with this plan.
During the first procedure, we extracted the teeth that couldn't be salvaged.
Yes.
Which were 4. And we cleaned the others.
Right.
And we prepared the damaged teeth for crowning.
Right.
Look at them nice and clean.
When did this happen?
Just before Christmas.
Okay, so how's Buster doing now?
Buster's doing great.
Right.
And I delayed discussing the case and discussing the story because we wanted to see what Buster's crowns would look like at the 1 month and the 2 month stage. And I have to tell you, they're fantastic.
Right.
And he's happy as Larry.
Now, because this will be kind of a new initiative as such, really, and coming up with these plans, so is this something that could take off?
Could take off if the cost can be managed.
Yes, and there goes the
issue.
There goes the issue.
Even the radiography, to be sure exactly what to do and which ones to extract and which ones to crown and so on. Even that's an expensive process.
Right. Yeah. So it would be a couple of grand at least.
Yeah. But there is a lot we can do for a couple of hundred.
Yeah.
At the same time. So most of our dentistry is at the price tag of a few hundred.
Yeah.
And most of it involves necessary cleaning and extracting to improve the dog or cat's quality of life. And cats get just as much dental trouble as dogs, by the way.
Right.
Particularly as they get older.
I'll post those photographs. Okay to post those photographs on social media later on and just let people know.
As I say, so we're not betraying any confidence.
No. We're talking about Buster. No.
It's just a fun case. It's interesting to see what can be done with a bit of innovation.
Right. And how is the owner must be delighted how it all...
She is delighted because she has the satisfaction of knowing she was able to use her own talents and skills to help her dog.
And that's what it is. Well, that would have kept the cost down anyway, obviously, just with her own labour and everything else. And was it just a team effort? You all just came together and did it?
Team effort. You see, bear in mind the anaesthesia, the pain control, and the whole management of busters, hospitalisation and dentistry needed to be done within a veterinary setting.
Okay, so when it came to the nitty-gritty of physically putting the crowns on and all, was that a specialist?
No, in fairness to her, she worked away herself.
She did it herself?
Yeah.
Yeah, that is class.
It is.
Were you on hand, you were?
I was. It was great to be able to do it. Did you
get video footage or anything? Just for your own dexterity, just curious?
Not sure. I must ask.
Was it anybody, but any of the nurses did it or whatever?
I'd say somebody probably did.
Yeah, well, obviously they have the pictures, so they must have done something. But I was just curious, because it's a great case. It's a super case.
Just to tell people what can be done.
Some people are asking, there's a few more than one people asking just cost. But I mean, at this moment, because that was experimental, it's a different type of. You couldn't really give a figure. You'd have to go and have a chat if they were to try it again and see where you're at. But it depends on the amount of teeth as well.
Now you see, the difficulty is as well. Remember, we discussed this before. Currently, veterinary dentistry is not covered by pet insurance.
Right.
Now, one of the things I like to promote is the old pet insurance end of things, because then when high-end and highly expensive stuff needs to be done, you have the wherewithal to do it because you have your insurance policy. Right. But veterinary dentistry, which at the level of X-ray and crowning is going to be into thousands, unfortunately insurance doesn't cover that. Yeah.
Okay, good stuff. Right, we'll come back to other stuff. Actually, you want to, there was something else besides the dentistry. You wanted to mention horse dentistry as well, didn't you?
John, do you ever hear the expression, John, don't look a gift horse in the mouth?
Yes, I can imagine, where that comes from,
Don't look a gift horse in the mouth. Do you know where it comes from?
No, something to do with that anyway.
Yeah, well, you see, back in the olden days, you see, if somebody gave you a horse as a gift, as a present, right? A horse would have been kind of a familiar thing that might be given as a dowry or a wedding present. Right, okay. So it would have been considered very impolite to look a gift horse in the mouth. Look in the mouth. Because why would you look in his mouth?
Yeah, exactly.
You'd look in his mouth to age him, to see what age he is.
Okay.
Because one of the common tricks that horse dealers used to try and pull years ago was they try and pass off an old horse as a young horse.
Yes.
Because a young horse would be worth more, naturally. So an old horse would be worth less. Now, the thing about it is, if you have a good look inside a horse's mouth, you can actually tell the age of a horse from their teeth.
Right, okay.
Because they age chronologically, their teeth age them as they get older. And the reason why that is because they're a herbivore.
Okay.
They chew consistently, they chew methodically, year by year by year, and the teeth wear. The teeth erode and wear in a very consistent way as they get older. Okay. So you can accurately age a horse by their teeth.
That's excellent. Great bit of tipping if you're thinking of getting yourself an old horsey. Okay.
Yeah. Here's another one. Did you ever hear the expression as rare as hen's teeth?
Yes.
Do you know where that comes from?
No, but you're going to tell me.
Yeah. Hens don't have any teeth.
Yeah, that's true too.
Birds don't have teeth.
Birds don't have teeth.
They just have a beak and they crunch with the beak.
With the beak and then swallow.
And then, come here, do you know how they break up their food and dissolve it and digest it further, seeing as they don't have teeth to chew it?
No.
Well, after they swallow their food particles, it goes down into a little forestomach, a little compartment in front of the stomach called the gizzard.
Right, And
the gizzard is full of pebbles and sand.
Right.
And the gizzard moves like a stomach and breaks up the food matter into digestive particles with the stones and sand that are present within the gizzard.
Yeah.
So anybody out there keeping hens or birds, right? They need sand, they need pebbles, they need grit.
Yeah.
Because they actually have to ingest it, they have to take it in, they have to have it in their gizzard to help them break up and digest their food.
That's unbelievable.
So garden hens now, or backyard hens, should be fed off the ground.
Right.
Yeah, for that reason.
For that reason alone. There you go. You learn something new every day. Right, couple of questions coming in. 3 or 4 questions were coming in there the last couple of moments. That was an absolute terrific story about Buster. Do you think it will become popular? Look, we were just
as the costs come down. I know of one veterinary dentist in Ireland who attends Dublin Zoo, attends animals of every shape and size and species, and her veterinary career is solely and exclusively dentistry. She's a veterinary dentist working out of one of the larger hospitals in Dublin, does nothing but dentistry, and most of her cases would be in the thousands cost-wise.
Okay, right, a couple of questions. Beatrice is on. She says she has a 2-year-old cat. He predominantly stays outside, but sometimes he sleeps in inside during the day, but most nights he comes, after coming in from outside, he just non-stop howling. He meows, he meows, he meows. What is going on? He doesn't calm down. Is that him just giving out to us because we left him out overnight?
Yeah, looking for food, I would say. He probably calms down after a while after he's fed. 2-year-old healthy cat, burning hundreds and hundreds of calories out on the prowl. And he's probably ravenous when he comes in.
Right.
I would say a good feed.
If he's very healthy and he's grand and he's in good form, obviously there's nothing wrong with him.
Nothing wrong with him. Give him a worm dose and probably up his grub a little bit.
There you go, up his grub a bit. Yeah. I like that. Okay, let's have a look. There's another one up to come in. Hi guys, could you ask Des? My dog Molly is a Bichon Frise. She used to love a spin in the car, but now when I bring her, she's shaking and afraid and hides underneath the seat of the car. Can you give us anything to help her, or what can we do next, says Karen?
Right, so she's becoming
what would trigger
fearful
that,
of travel. What would trigger that is, okay, either she got sick, she had a bad experience in the car, or she had a bad experience when she arrived somewhere recently. Right. So where have you brought her recently that was scary, that she didn't like, where she didn't enjoy being there? It could have been a trip to the vets, in fairness, and she had a couple of injections. And she's terrified of going back.
Something simple,
Terrified of going back there. It could be something simple like that. So now she's developed an aversion to travelling because of fear of either something that happened in the car or something that happened when she arrived.
Yes.
So you need to break that fear by changing the association around the travelling. Go for lots and lots of little short journeys and give her treats, give her something nice after the short journeys. But it'll take repeated short trips with maybe giving treats in the car to try and lessen that fear.
Right. What about if she's going into the car? You've often mentioned calming products.
Yeah, it could help a little. Yeah, could help a little. The calming products like NutriCalm are the natural ones, or you could use Trazodone and GABA if you have to bring her on long journeys.
Would that be just small doses, or would you give her a proper dose?
Yeah, small doses of... Okay, so keep her on NutriCalm all the time, and it might help generally with the nerves, with the anxiety. As regards to sedatives for the journey, I would say just little doses until some of that elevated heart rate and fear kind of lessens and reduces over time. Dogs are creatures of habit and they live in the moment. You can break that cycle by changing her habits and helping her change her mind.
Okay, another one in from you guys. Okay, thanks very much. Is it unusual for a neutered female cat about 9 months to wander off for a while? She's mostly inside, but she has a tendency to go outside. She was a feral kitten when we took her in. Now she's tamed. She's gone 2 days now. Any suggestions?
Okay, well, typically most cats will disappear for 12 hours at a time and come back when they're starving hungry.
Okay.
So a young female like that, who particularly was a feral, that's not surprising. She wants to hunt and she's out and about and she's hunting. Now, on the other hand, if she has suddenly gone missing and it's not just 12 hours, this time it's not just overnight, she's gone for a whole 2 days, then unfortunately something might have happened, and it might be a good idea to check with the neighbours. If you have a neighbourhood group, put up some notices. Do go looking for her, because 2 days is too long. 2 days means either something has happened or she's been fed and taken in by somebody else.
Yeah, and that happens with cats, to be fair.
It does.
It does.
If they're being fed and looked after and they're warm and healthy in one place, then they'll have a little holiday and they'll stay there for a while before they decide to go home again.
Yeah, that happens. And she just said, put a covering note. Also, if anybody sees her, she's a beautiful striped and white ginger cat from Iron Hills, Suncroft, Kildoon area. So if anybody sees her, she's about 9 months old, young cat, gone missing for the last couple of days. So yes, it is. It's probably a little bit unusual. There's 2 full days. You have to wait and see, but maybe do a little bit.
Yeah, definitely check with the neighbours. 2 days is too long.
Yeah, I know what that's like. That has happened with me. So yeah. Right, guys, how many treats is it okay to give a small dog daily, says Anto? Well, I suppose the definition of treats.
It depends what they are. Are
you talking the treats you buy or the treats that you... Yeah, okay.
I mean, look, there are nice, healthy treats that are sugar-free and you can use them as training aids. Don't give a dog a treat for nothing, though.
Yeah.
Do incentivise them.
Right.
In terms of use it to help improve their recall, improve their behaviour. Use it for training, maybe just a few in the evening as part of your evening run.
Okay, I asked you this before because, look, I will not lie to you when it comes to my cat. We don't give him big tins of food. We give him like the little sachets, and we'd give him a half sachet, and we'd also give him nuts that we've got, right?
Yeah.
Also, he does get a little bit of a treat here and there. Absolutely. If there's a bit of leftover chicken that's cooked or wherever, we'll give it to him.
Yeah.
Is that safe to do?
It is, to be fair, it is safe. Remember, so cats are carnivores.
Right.
But they're not particular in terms of what type of protein they take in. They're a multi-species, versatile hunter. So you can feed a cat nearly any type of protein.
Okay.
And it's harmless enough, in moderation.
Right.
And as regards dogs are omnivores, so dogs need variety. So the type of treats that are good for dogs would be carrots.
Yes, I've seen that before. I've seen
and
carrots.
lots of them like carrots.
Yeah.
And we have found...
I presume the uncooked ones are cooked.
Uncooked. Uncooked carrots.
Crunchy carrots.
Blueberries are very good as well, and they love them.
Do they?
Yeah. Blueberries are good. Bananas are okay as well. Bananas and apples are okay.
Okay, fair.
Yeah,
right.
yeah.
Now everybody's going to start messaging in. So listen to me. Everybody, blueberries have become so trendy and fashionable within people's houses over the last few years or so. So now what you're saying is, did they bite them, chew them? Did they play with them? Now, in saying that, I saw my cat running around chasing a blueberry and flicking it around the place, playing with it the other day.
Well, I caught Katharina using blueberries as treats and said, what did you give her blueberries for? Oh, yes, she loves them. And sure, then I had a look, and there's blueberries in the bag, in the food.
Right.
Yeah. Blueberries are an ingredient in some dog foods anyway.
Okay, didn't realise that.
Yeah, and those nice packs of blueberries that you can buy in the supermarkets that are washed and clean and they're healthy, they're perfect.
Will they sniff around them first and then just bite into them?
Yeah, exactly. Now, look, if a dog is not adventurous and cautious, they might... I've seen them... Probably our previous dog would have just pushed them around the floor and sniffed them and ignored them. So some dogs will literally just sniff around things and ignore them. People tell me some dogs love broccoli, for instance.
Right.
And I definitely know other dogs who would sniff the broccoli and walk away.
Yeah, okay, a bit of everything. Okay, couple more quick questions. Here we go. I have a 14-year-old Shih Tzu who will not poop in the garden, so he has to be walked to go. He has arthritis in both of his front legs at the moment, so walking is difficult for him. We try to only keep him in the garden, but he won't go. He'll hold it for days. Any tips, says Kate.
Out for little walks, little and often.
He
definitely needs his little walks out and about.
Because that's what they do. They smell other things going around, and that creates the urge to go.
To be fair, he's probably nicely trained in that he thinks that a manicured garden is, a forbidden place that he shouldn't use.
Right.
But take him out for little walks out to the Curragh, inside the racecourse area there, along the canal banks, that sort of thing.
Yeah.
Do give him a good quality of life and a good variety, and find a few places where he can go, even if it's only for 5 or 10 minutes a couple of times a day.
Yeah.
And by the way, the arthritis, we've talked before many times about the medical options we have for treatment of arthritis. There's laser therapy, there's hydrotherapy, as well as the medications, be it aspirin, carprofen, Rumacam, all the different medical treatments. Talk to your vet, get your little dog on something for the arthritis, and then the walks will be more possible.
Okay, Gavin McCarthy on. A quick question. My dog has taken to eating turf. How do I stop it? What's he doing? He's a Shih Tzu too. Little Shih Tzu.
Yeah. Okay, so wants more roughage in his diet.
Is that it?
Yeah, I would say so.
Yeah?
Yeah, have a chat to your vet and do a little bit of analysis on the dog's diet, and we'll get to the bottom of what's he lacking.
Right, come back to us on it.
That.
Yeah, try it. Yeah, try it. Okay, right. Okay, fair enough. And one final one. I have a Cavapoo that has put on weight after being neutered.
Yeah, you see, after neutering, be it male or female, the metabolic rate drops 10%. In the absence of the sex hormones, the female and male metabolism drops 10%, meaning their calorie intake daily needs to be 10% less. So they need to be fed less, and as they get older, they need to go on a senior diet and go on a lower calorie diet. So go on a bag that's marked maintenance and not one that says it's for working dogs, for instance. So weight gain is caused by a slowing metabolism. So you need to feed your dog not just less, but more importantly, probably also a different diet.
Okay, great way to finish. That's a great bit of advice, as always, from Des. Thanks to everybody who's been sending in loads of questions. We'll get to more of them again next week. 0833 97 97 97 if you ever want to get in touch with us, or send us pictures of your doggies and stuff and whatever. I'll get a chance, I'll put up those pictures of Buster a little bit later on. Well, Buster's moles on his teeth.
Yeah,
actually, do we have a picture of Buster? You can send it to me if you do, and we'll add it to we'll add it to the thing.
Yeah,
okay, in the meantime, thanks, Des.
Yeah, cheers, John.
It's a pet's life with Gym Dog, Ireland's first pet resort by Des the Vet. Managed by vets, loved by pets. Daycare, vet care, premium pet food and grooming. Visit at petslife.ie.
Thanks, Des. And that edition of Pets Life will be podcast a little bit later on this afternoon.